Good morning, little nerds. I'm Dr. Shereene Idriss, and welcome to Pillow Talk Derm, where we do this every Saturday morning at 10 a.m. Who the hell am I? I'm a board-certified dermatologist. I'm based in New York City. If you haven't yet subscribed to my channel, subscribe below and let me know what you want to learn about next week, but don't forget to like this video. Today, we are going to cover acne scarring because the nightmare of your teens and early 20s might have been gone, but they've definitely left their mark on your skin. And although I am somebody who's fully all about body positivity and enjoying and embracing the bodies that we have, it is important to understand that certain things are medical conditions that can be treated, and if treated early on, you will save yourself a lot of headaches down the line. Acne scarring is something that people do not necessarily choose to live with because they have no choice but to live with it. And so how best you can help yourself with acne scarring is something that I hope to help you with in this video. Before I jump in, I actually have a whole acne care video that I will link below in case you are actively breaking out, because I do think it is important to try to get ahead with acne to hopefully minimize the active breakouts. So when it comes to acne scars, right, there are different types of acne scars, and it's not all textural. The biggest bucket that you first see when you're thinking of acne scars is color, like this, where you have pigment changes. It's either going to be turning red, brown, or even lighter in color, and this is known as post-inflammatory erythema, post-inflammatory hyperpigmentation, or post-inflammatory hypopigmentation, the white spots. But most people, when they think of acne scarring, thinks of this: textural changes on your skin. But not all textural changes on your skin are created equal either. You're gonna have scarring that is atrophic, meaning it dents in, versus hypertrophic, meaning it pops out. And the way that you address these types of scars also differs. So the way we're gonna go throughout this video is first talk about the color associated with acne scarring, followed by the texture associated with acne scarring and how you can best help yourself at home. Number one, when it comes to color, like I said, is redness. And this is known as post-inflammatory erythema. This happens when there is superficial blood vessels on the surface of your skin that are inflamed and that get dilated in the process of an inflammatory response. So when you have acne, there's a lot of inflammation happening on the surface of your skin. With that, these superficial blood vessels are getting dilated. And once the inflammation resolves, the blood vessels are left dilated. That's another reason why you do not want to be picking at your acne scars, because you're going to be causing more trauma to these superficial blood vessels, leaving behind redness way long after the inflammation is gone. Biggest issues here is that it causes significant color change in people with fairer skin tone. But do not be fooled. Even darker skin types can get post-inflammatory erythema. You just have to be more attuned to seeing it. But it doesn't mean that if you have a darker skin tone, this does not apply to you, because it does. It applies to everybody. If you're a human being, you can get this. It is the most often form associated with post-inflammatory anything when it comes to acne. And it can resolve on its own over time, but you want to look for ingredients that specifically target redness and inflammation. Niacinamide, but not more than 5%. You really do not need a 10% niacinamide treatment. Anything at 5%. Centella asiatica is something that has been around for quite some time. When you combine the two, it is a beautiful marriage in helping minimize that inflammation. I'm going to be talking about some of my products in here. I will link below videos where I talk about a roundup of other products, but to keep things simple, I want you guys to have understanding. And so I'm just going to use my products as example. It doesn't mean you have to purchase them, but the Depuffer, for example, is a marriage. It's a serum that marries Centella asiatica as well as niacinamide, not higher than 5%, and arnica to help with inflammation and swelling, so that you can hopefully minimize that swelling early on and that redness early on. Other ingredients that you can look for that are going to help with redness: azelaic acid. 10% azelaic acid over the counter is where it's at. Usually anything below 10% will have some helpful effects, but not quite what you're looking for. And ideally, if you can get a prescription at 15%, that is where you want to get. But 10% is where it's at if you have active acne or redness associated with acne. This is the Redness Relief Azelaic Acid Serum by Peach Slices. I think it retails for $19. Azelaic acid has really good anti-inflammatory properties, and it will help both with post-inflammatory erythema and hopefully minimize that from becoming brown in the long run, and you get developing post-inflammatory hyperpigmentation. The third ingredient that not many people speak of when it comes to acne marks, especially the red ones, is allantoin. Now this I bought from CVS as a generic. This is allantoin at 0.5%. Allantoin is an ingredient that you often find in scar creams. It causes your keratin to soften and to retain moisture better, so you don't go into overdrive, into overproducing collagen. It helps your skin heal faster. So if you're looking for a very basic allantoin gel, this one is from CVS. I believe Mederma also has allantoin in it. I'm not sure the percentage of it. It's something for you guys to look for. Now shifting gears into brown discoloration, post-inflammatory hyperpigmentation. This is the category that you guys, when you guys walk into CVS, Ulta, Sephora, Walgreens, any sort of beauty store, when you see on beauty products, discoloration, like here, like I wrote, for all types of discoloration, this is what we're talking about. It's not just sunspots. It's not just hyperpigmentation because of a scar. It's not just melasma, which is a form of discoloration. It is all types of discoloration. This is where your ears should be ringing, especially if you have acne scars that have turned brown. So if you have post-inflammatory hyperpigmentation, the redness has now become brown, or you've picked too much and you have brown marks left behind, or you were sunbathing in the sun when your acne was inflamed and it's left some dark spots in its wake. Is that the right expression? I don't know. Dark spots or the acne lesions that have been left behind, this is post-inflammatory hyperpigmentation. You should be looking for products that target all types of discoloration. They're never gonna actually claim acne hyperpigmentation because that would be considered technically a medical diagnosis. They're going to lump it underneath the discoloration umbrella. And normally when you're thinking discoloration, you're thinking brown. You're not thinking red. Different ways that we can treat hyperpigmentation and discoloration. I'm going to link below a video that I've done in depth on this topic. I did a deep dive on dark spots and I have a bunch of recommendations in that video as well. For simplicity's sake, I'm going to focus on my products today, but you guys can click that video to get access to all the other recommendations that I've talked about in the past and in the present. When you are targeting hyperpigmentation, the most important thing that you need is sunscreen. Any sunscreen will do. The sunscreen that you use will do. Play by Supergoop. It's just one that I have in front of me. I have a whole bag of sunscreens over here. Iris and Romeo is one that I was told I should try out, so I'm going to be testing it out. This is one by Neutrogena that I recently found at CVS that I bought. But any sunscreen that you like, you should use, because when you're protecting your skin and you're minimizing those active breakouts from getting darker, you're also protecting yourself in the future from developing hyperpigmentation from your acne marks. So that is my sunscreen spiel for the day. If you have acne, find the sunscreen that works best for your skin. You have to kiss many frogs until you find your sunscreen, especially in the US, because we are limited in the US to the filters that we can use. But do not be afraid of chemical sunscreens either, because they oftentimes are way more elegant. And quite frankly, I love hybrids, the marriage of a chemical filter and a physical one. 2, you want to know how to exfoliate. Now, let's say your acne has resolved. You're no longer in that weird oily phase of having really a lot of sebum. You're not producing a lot of oil, but you want to help now the texture that's been left behind and some of that brown discoloration. AHAs like glycolic acid, lactic acid especially, mandelic acid are key in helping exfoliate your skin while also blocking how your pigment is produced. So, Major Fade Flash Mask is my exfoliating acid mask. It has glycolic acid and lactic acid in it. There's another ingredient known as tranexamic acid, but tranexamic acid is not an exfoliating acid. I just happen to marry it into my exfoliating mask so that it can work more effectively at the levels that we were able to get it over the counter. Normally, tranexamic acid is prescription and even oral. So this is kind of a nice mix between at home and in office. Really help your skin renew itself faster and more efficiently by getting rid of that superficial layer of hyperpigmentation by using an exfoliating mask. A hack here is you can literally take this mask. Let's say you just have one brown spot and simply take a tiny bit and apply it just to the spot that you have. And do that every single night without irritating your face or inflaming your skin barrier as a whole. You can use it as a spot treatment in addition to using it as a full face mask. You want to look for ingredients that are going to inhibit tyrosinase, the enzyme that is responsible for melanin production, right? And by blocking tyrosinase, that reduces the amount of melanin that's going to be produced. So when you have inflammation, tyrosinase is hyperactive, more melanin gets produced, you get post-inflammatory hyperpigmentation because you have more melanin that's produced in that particular spot. So you want ingredients that are going to be tyrosinase inhibitors. Things like kojic acid, arbutin are key. And arbutin was one that people are used to be scared of and tell you, do not use it if you're pregnant. The American Academy of Derm actually has come out with a statement that you can use arbutin while pregnant. Arbutin is a precursor to hydroquinone, but the amount that gets converted to hydroquinone, which is the active form, plus that gets absorbed systemically, is minimal. So if you're somebody who is suffering from large, dark brown spots and you are in pregnancy, you can always check with your OB. But according to the American Academy of Derm, arbutin is safe. Licorice root extract, diglycosyl gallic acid is another interesting one. All of these are in the hyperserum, which is the serum part of my major Fae trio, targeting all types of discoloration. It comes in a pen. It's a powerhouse serum. You can use it twice a day. You can use it again just on spots, or you can use it all over your face. Vitamin C. Vitamin C is not a holy grail ingredient. It is not the only ingredient that you need when you're targeting all types of discoloration. According to the beauty industry, you're going to think that you only need vitamin C, but you need it amongst other things like we just talked about. Sunscreen, alpha hydroxy acids, tranexamic acid, tyrosinase inhibitors. So you need vitamin C in addition to all of that if you have really bad discoloration. I personally love tetraxyldecyl ascorbate. It is a vitamin C ester. I put it in my moisturizer so that you can use it every day, twice a day. It is not the active form of vitamin C. The active form of vitamin C is called ascorbic acid, kind of like in SkinCeuticals CE ferulic. But not everybody can tolerate ascorbic acid, and if you have sensitive skin, it might actually inflame some of your acne marks and turn them even more red, which might make them more brown in the long run. And so if you're sensitive, look for a vitamin C ester instead of the active form. If you're not sensitive, knock yourself out with the active form, but just be careful marrying the active form to the next ingredient, which we're going to talk about, because it can be irritating because they are both quite aggressive. The last ingredient you're also going to need is a retinol. Now, retinol is the over-the-counter form. This is the inactive form of tretinoin. Both of these, tretinoin and retinols, are retinoids. They're vitamin A derivatives. They accelerate cellular turnover on the top layer of your skin, but that does not mean it thins your skin out. It's just going to make your skin turn itself more efficiently so that any lingering hyperpigmentation can get turned over faster and you can start getting clearer skin faster. It also does regulate the activity of melanocytes, which is the cell responsible for producing melanin, which is the pigment that you're seeing. I will link below my retinol video so I can give you more retinol options as well. Azelaic acid is another ingredient you can also add for hyperpigmentation and discoloration, not just redness, because like I said, when you're treating the redness early, it can minimize that inflammation that gets left behind. But once you have inflammation and post-inflammatory hyperpigmentation, azelaic acid can serve as a great anti-inflammatory to help minimize any further hyperpigmentation. And last, prescription, hydroquinone. Hydroquinone is the gold standard, and if you have a lot of discoloration, you might want to look for a prescription from your local board certified dermatologist for hydroquinone. But with hydroquinone, you cannot use it long-term forever. You have to take breaks because two things. One, you can become resistant to it. By taking breaks, that really minimizes that. But number two, you do not want to develop something known as ochronosis, which is permanent discoloration of your skin. You need to be under the guidance of a doctor while using them. Those are the ingredients targeting post-inflammatory hyperpigmentation. So within the color, we did red, we did brown. Now we're quickly going to talk about lightness, hypopigmentation, loss of pigment, which can also happen where you get acne marks and they look whiter than the rest of your skin. Now this is due to inflammation that can kill your melanocytes in the process and cause hypopigmentary marks to happen. It's way less common, but it can still occur. And the way you treat it, quite frankly, you have to go in office. Because you're going to either need a prescription or do a treatment in office. And usually the prescriptions that are used to treat this are topical corticosteroids, which counterintuitively can also cause hypopigmentation. So you have to do it under the supervision of a dermatologist. A steroid will help minimize any residual inflammation left behind that is blocking the production of melanin. But another interesting thing, and I've done this on Tiffany who works with me, is using Latisse, which is usually used to treat glaucoma or to help with eyelash growth. But it does cause, as a side effect, hyperpigmentation. So when you combine it with light microneedling on a hypopigmented scar, you can repigment the skin. And so that is something that is very interesting. So now that we've covered pigmentary changes, we're going to quickly touch on textural changes. When it comes to texture, you either have atrophic, meaning dipping in scars, or you have hypertrophic, meaning popping out scars. And when you're talking about texture, Rome wasn't built overnight. You're not going to restructure your collagen overnight. All of these treatments are going to take time, anywhere from 18 months to 24 months. I'm sorry if you don't like to hear that, but it is a long game, and better that you know it so that your expectations are aligned with reality and you don't get disappointed. When you're talking about atrophic scars, the scars that dip in, there are three main types. There are ice pick scars that look like this. There are boxcar scars that are basically boxed out like that. And then you have this undulating pattern that looks like a wave, also known as rolling scars. None of these can be treated with over-the-counter treatments alone. Using a retinol and exfoliating regularly will help in the long run for sure, but you probably need in-office treatments as well. Whether it is 1, 2, 3, 4, 5, or all of the above, usually when I'm treating my patients, I do a little bit of everything over time, and I let my patients know, like I just let you guys know, that it is a marathon. It's a long game. Number one is microneedling. In-office microneedling, not the ones that you do at home, because you have to go deep and you really have to start stimulating the fibroblasts deeper within the dermis. I oftentimes marry microneedling to PRP, which is when we take your blood, we spin it, and we get the platelet-rich plasma to allow your skin to heal more effectively. You can also marry microneedling to heat, like radiofrequency heat, like the Secret RF or Morpheus. Again, this has to be done under skilled hands, because the last thing you want to do is cause hyperpigmentation and worsen any residual discoloration, or worse, cause it. TCA cross is another method that people use for the ice pick scars, where we take acid at a really high percentage, nearly 100%, and apply it very precisely within the ice pick scars to allow that scar to heal from the bottom up. And subcision, where I take a plain old needle, a big one, and I go and I try to cause some trauma underneath the surface of the skin while depositing a very light amount of filler, and the right kind of filler, to keep that wound open. So it allows for your skin to heal over time and not just collapse after you've subcised it, meaning after you've sheared the tissue underneath. And then you have other things like lasers, like Fraxel 1550, it's a non-ablative one. You have the CO2 laser where we burn your face off. You have the Clear and Brilliant, which is the baby version. There's a lot of different lasers that we can do for texture as well. But doing laser alone is not gonna give you the results of your dreams. Doing microneedling alone is not going to give you the results of your dreams. None of these alone is going to get you to where you want to get to, and it's usually a combination of treatments. Then last, we have our hypertrophic scars, the scars that pop out. And with this, you have to be very careful that somebody is not prone to forming keloids. So you got to be careful with how aggressive you are in office, but usually you can inject a steroid into the hypertrophic scars to soften the scar and to minimize the growth factors there. Using silicone strips like this one is also very helpful, because this can also help by retaining the moisture in your skin, softening your scar, but also modulating without injecting, meaning it can affect how growth factors are secreted underneath the surface of the skin without putting an actual injection in, like with a steroid. Also V-beam. Usually when you have hypertrophic scars, you have a lot of dilated blood vessels that are feeding that scar. When you basically zap those blood vessels with a laser like the V-beam, a pulse dye laser, you might kill the food source of that scar and over time minimize their appearance. All this is to tell you that when you have acne, hopefully you treat it before it becomes bad, and hopefully you treat it before it leaves any permanent residual effects on your skin. But even when you have those permanent residual effects on your skin, we can do something to help the overall quality and texture of your skin. It just takes time. It's a group effort. It requires both a knowledge of over-the-counter products like we talked about today, but also in-office procedures, so that you're not taken for a ride and you don't buy a package of 5 Fraxels when really you might have needed just one, plus a subcision and maybe a couple of microneedlings in between. So now that you are more educated, I hope you're more informed. I hope this video was empowering to you. And I hope you guys have a beautiful Saturday where you respect one another, love one another, and treat each other with kindness and respect. I'll see you guys next week. Have a beautiful Saturday.